Welcome to the deep dive. Today, we're embarking on a really fascinating exploration. We're looking into a part of your health you might never fully connect it to your overall well-being. We're talking
Yeah.
about your teeth, but not just the usual cavities and cleaning.
Right, going deeper than that.
Exactly. We're asking, what if your dental health goes far, far beyond what we conventionally understand? What if it holds these surprising, often overlooked connections to the rest of your body?
It's a big question.
It is. And our mission for this deep dive is, well, to give you a clear, concise understanding of a pretty intriguing subject: neurofocal dentistry and neural therapy.
Yeah.
We're going to unpack these concepts, drawing on insights from a highly specialized dental expert. Think of this as your shortcut to grasping how what's happening in your mouth could really be a doorway to understanding your broader health.
Exactly. And I think you should prepare for maybe your perspective on dentistry to shift a bit today, because we're going to reveal how every single tooth might just be this crucial, interconnected piece of your overall health puzzle, revealing connections you probably never ever imagined.
Okay, that sets the stage perfectly. So let's dive right in then. You're clearly not coming from a place where teeth are just, isolated parts you can pull out.
Not at all.
What was your own journey? How did you discover this profound connection between teeth and the body? What led you down this less conventional path?
Well, it was quite a personal journey, actually. Back when I was studying traditional dentistry, I started experiencing pretty significant cervical and lumbar problems myself. Painful
Oh,
stuff.
wow. While you were still in school?
Yeah. And I was fortunate. I was treated by an acupuncturist and rheumatologist who, funny enough, happened to be a patient of my grandfather's.
Small world.
It really was. So he would treat me, and very subtly, during my appointments, he started handing me these small, kind of unassuming books.
Hmm.
At the time, I was just completely immersed in my, conventional faculty textbooks, piles of them. So I didn't really pay much attention initially.
Little books. What sort of topics did they cover? I mean, if you're deep in traditional studies, they must have seemed a bit out there.
They probably did seem that way, yeah. They were on subjects like heavy metal intoxication or orthodontic issues that just weren't covered at all in conventional dental studies. Honestly, I didn't give them much thought. Not until after I graduated.
Okay, so what happened after graduation?
Well, then I received a very difficult personal diagnosis, a health issue. And given my years of trust in this doctor, I confided in him.
Right.
And he just looked at me very calmly and said, "I was waiting for you."
I was waiting for you. Wow.
Yeah.
That's a truly pivotal moment, isn't it? Especially with your own health situation unfolding. What did you think?
It was startling. Yeah, almost surreal. He then told me, "When you finish your studies, I'm going to take you to study this." He gestured towards the kind of work he did.
Study what exactly?
He said, "I'm going to give you your first session." And then he explained his own background: rheumatologist, acupuncturist, and a practitioner of neural therapy.
Ah.
He said, "Didn't you realize I was giving you those little books to subtly guide you?"
So he had been trying to nudge you all along.
Exactly. He said, because every neurotherapeutic doctor needs a specialized dental expert to work hand in hand. That's when I had my first neurotherapy session.
And how was that? Especially given your diagnosis.
I was very overwhelmed by the diagnosis at that point, really struggling. And that session, it was like a profound reset. Almost miraculous, honestly.
Wow.
Everything just clicked into place. It became crystal clear that my diagnosis wasn't going to impede my path in health. It was a turning point.
Your personal journey clearly shaped this unique perspective then. It really sounds like neural therapy was incredibly pivotal for you.
Absolutely.
So for our listener, could you just explain clearly what exactly is neural therapy, given its central role in this whole approach you're describing?
Of course. So neural therapy, it's essentially a branch of medicine or dentistry focused on retuning, or you could say resetting, the central nervous system.
Okay, resetting the nervous system. How?
Think of your central nervous system as your body's main electrical grid and communication network, right? Neural therapy aims to help it function optimally again. It's a bit like rebooting a computer that's gone haywire.
Got it.
And from the perspective of neurofocal dentistry, the core principle, the really key idea, is that teeth are not isolated. They are directly connected to specific organs and systems throughout your body.
So neurofocal dentistry uses neural therapy to address these connections.
Precisely. It seeks to resolve any illness that might be affecting either the tooth or its corresponding organ by working with these systemic connections.
Okay, so you're saying problems in your teeth could directly show up as issues in seemingly unrelated organs. That sounds, well, pretty surprising.
It does sound surprising at first, I know.
Could you give us some examples, like how does this tooth-organ connection actually play out in practice?
Absolutely. For instance, you might find yourself treating an otitis, an ear infection, by addressing an issue with a second upper or lower molar.
An ear infection from a molar? Really?
Yes. Or another example, you might help someone recover from diverticula, those small, often painful pouches in the intestine, by treating a problem found in their lower molars.
That's fascinating. But what about things like implants? How do they fit into this picture?
Implants. That's where it can get complicated within this framework. You see, an implant, usually with its metal post or screw, can sometimes interfere with the body's natural energetic or electrical fields.
Like causing interference?
Almost like a tiny antenna causing interference, yeah. And this interference can then potentially cause or complicate issues, even in distant organs, like those diverticula we just mentioned.
So placing an implant isn't straightforward in this view.
Not always, no. So when people ask me about implants, I conduct a really thorough life history assessment first. It's not just a simple procedure where you place the implant and you're done.
Right.
We need to understand the patient's overall health landscape. Is their body truly ready? Can their entire system integrate this foreign object without creating new imbalances?
And sometimes they fail because of these connections.
Sometimes, yes. An implant might fail precisely because its connected organ system was already unhealthy or stressed. It reinforces that the connections, the segments, are continuous. Everything is very related.
It sounds complex.
It is,
Yeah.
but the positive side of this, the really hopeful part, is that it also highlights the body's incredible innate power to heal itself. Once these connections are understood and addressed properly, healing can happen in ways you wouldn't expect.
That's truly astonishing to think a molar could influence an ear infection or gut health. Wow.
Mm.
And if these connections are so profound, it really makes you wonder about common dental things. So let's turn to something many of us have dealt with: wisdom teeth.
Yes, the third molars.
When is extraction really necessary? And how does that decision relate to this broader understanding of the body's interconnectedness?
Well, wisdom teeth are frequently problematic, as you know, mostly because our jawlines have actually shrunk over generations.
Right, less space.
Exactly. There often just isn't enough room for them to emerge properly, so they can become impacted, meaning they're stuck, unable to come out fully, or they cause hygiene issues because they're only partially erupted and really hard to clean back there.
So in those cases, extraction makes sense.
In those cases, yes, extraction is often indicated. But the complexity of wisdom tooth extraction is, well, it's significant, especially the area we call the ganglion area that's basically the angle of your jaw near the back.
Why is that area so tricky?
It involves this incredibly intricate network of nerves and ligaments. It's a real, well, a tremendous mess, structurally, you could say. So it's definitely not a simple procedure.
And are there deeper connections here beyond just space and hygiene? Because this is where it seems like it gets really interesting.
Oh, there are profound connections. There's actually a powerful statistical study I often refer to. It was conducted across various European and U.S. neurological centers.
Okay. What did it find?
They observed a direct correlation, a startlingly high percentage, the majority, in fact, of adolescents hospitalized with neurological conditions were found to also have impacted wisdom teeth.
Wait, impacted wisdom teeth linked to neurological conditions.
Directly linked. And what's even more significant is what happened next. When these impacted wisdom teeth were carefully removed in these predisposed patients, their neurological disease actually began to heal.
Began to heal, just from removing the wisdom teeth.
Yes. It's a study that powerfully illustrates that dental health is absolutely not just about a cavity or a simple extraction needing space.
That's incredible.
The critical insight here is that an impacted wisdom tooth, one that's stuck and causing underlying inflammation or nerve pressure perhaps, isn't just a local dental nuisance. It can have measurable, direct neurological consequences.
That completely challenges the usual view, doesn't it?
It really does, and that's also why it's so crucial that wisdom tooth removals, especially complex ones, is performed by specialized maxillofacial surgeons. The risk of nerve damage, like loss of sensitivity from conventional procedures in that tricky ganglion area, is quite real.
That's a truly profound connection to neurological health. Most people would never, ever suspect that link.
Exactly.
Which I guess brings up a critical question. How do you even begin to know if a pain or a problem somewhere else in the body, say a chronic knee issue or an organ problem, is actually related back to a dental issue? Because honestly, like you said, a dental problem is probably the last thing most people or even most doctors would suspect.
It is incredibly difficult to isolate sometimes. You're absolutely right. And it is usually the last thing people consider. I can share a patient example if that helps. It was really compelling.
Please do.
Okay, so a colleague, a functional medicine doctor, referred a patient to me. She came from quite a distance away, actually. And she arrived looking quite confused, basically saying, look, I don't know why my doctor sent me to a dentist. I have absolutely no problems in my mouth.
Okay. So what was her actual issue?
Her primary complaint was debilitating knee pain, really severe. She'd already undergone 2 knee surgeries, and she was actually scheduled for a third one.
Wow. 2 surgeries already, facing a third, and she's sent to you, a dentist, insisting her mouth is fine.
Exactly. She was absolutely convinced her mouth wasn't the issue.
So where do you even start with that?
Well, I started asking questions. Lots of questions. Deep, extensive questions. I mean, I went all the way back to her birth, her whole life history, every little detail I could possibly think of.
Trying to find any link at all.
Any link. Honestly, I felt like I was running out of questions. I wasn't finding anything that made sense. Nothing was clicking. We were just talking, in a very relaxed way. And then suddenly, she almost gasped. She said, wait, I know. I remember now.
The aha moment. What was it? What did she remember?
Exactly. She recalled that when she was 15, living in another country, she was supposed to get orthodontics, braces,
Yeah.
and they needed to extract a premolar tooth because there wasn't enough space for everything. Standard procedure usually.
Okay.
But the dental expert made a profound mistake, a huge error. He extracted her canine tooth instead of the premolar.
Oh no, the canine. That's a really key tooth.
A key tooth, yes. And she described the surgery itself as profoundly traumatic, just awful. The doctor apparently realized the error after the extraction. She was so young, 15, and her mother was devastated, understandably.
What a nightmare.
Total nightmare. And after that, they tried repeatedly to place an implant in the canine spot, but it kept failing. Like 5 implants failed over time. Eventually, she just gave up and settled for a removable prosthesis, like a small, partial denture.
And you immediately saw the connection there, didn't you? This wasn't just about the physical gap, was it?
Instantly. It just clicked for me. I asked her, is that it? Is that the problem? She looked puzzled, like, what do you mean?
How did you explain it?
I explained that in neural therapy, these kinds of really traumatic events, especially involving surgery and anesthesia and that level of emotional distress, they can leave behind what we call painful memories in the tissues.
Painful memories. Even after it's physically healed.
Exactly. Imagine that trauma. Even though the gum healed decades ago, it leaves a kind of ghost signal, a persistent, subtle disruption in the body's communication pathways right at that spot. It's almost like a radio frequency that's always slightly off, broadcasting interference.
Like an energetic residue.
That's a good way to put it. An energetic residue from the original trauma. And this ghost signal, this painful memory, can then amplify new pains or even create seemingly unrelated problems elsewhere in the body.
So this old, deeply traumatic dental mistake from when she was 15 was still energetically impacting her years and years later, manifesting as this debilitating knee pain.
That was my strong hypothesis, yes. For this patient, what I did next was, well, felt pretty remarkable at the time. I told her, okay, hold off on that third surgery. Just wait. Let me try something first.
What did you do?
I gave her just one single injection, one shot of a neural therapeutic anesthetic. It's usually procaine exactly in the scar tissue where that canine tooth had been mistakenly extracted all those years ago.
Just one injection right there. She must have been skeptical.
She was definitely skeptical, asking why I was doing this in her mouth for her knee. But automatically, immediately after the injection, her knee pain completely disappeared.
Gone in minutes, just like that.
Gone. Resolution in minutes. It's actually rare for it to happen quite that fast, especially when you're treating at a distance like that from the mouth to the knee. But it worked.
That's absolutely astonishing. What is physiologically happening in those minutes? Is it just resetting that ghost signal?
Essentially, yes. Physiologically, it's like flipping a circuit breaker. That injection seems to interrupt and clear that persistent, subtle interference pattern, that painful memory signal in the local tissue and its connection to the nervous system. It allows the whole system to kind of self-correct.
So the trauma, the bad anesthesia maybe, the emotional shock, Left this trace.
It left a lasting energetic trace, yes.
Mm.
That painful memory was acting like a blockage, disrupting her entire system in subtle ways that eventually manifested in her knee. We just cleared that blockage.
Yeah.
Honestly, I felt like I didn't do much. It felt like the universe guided me to that specific spot from her story.
And you just facilitated her body's own healing ability.
Exactly. We simply allowed her body to heal itself once the interference was gone. And the best part, her knee pain never returned. Never needed that third surgery.
That is an incredible story, a truly powerful testament to the body's hidden interconnectedness.
It really is.
What a profound, deep dive we've had today. We've truly seen that the body is this incredibly interconnected system, hasn't it? And that dental health, well, it's a crucial, yet so often overlooked component of our overall well-being. So wrapping up, what does this all mean for you, our listener, as you navigate your own health journey?
I think it primarily means that dental issues are very rarely just isolated problems. Understanding these deep connections, these neurofocal links, can potentially open up unexpected pathways for healing.
Pathways you might never have considered.
Exactly. And it can lead to a much more holistic, integrated view of your own health. Ultimately, knowledge, when it's truly understood and then applied, is incredibly valuable and, I think, really empowering.
Absolutely. Couldn't agree more. And with that powerful thought, we're left with maybe one final provocative question for you to ponder. What other isolated health problems might you be experiencing? Could they possibly be connected in surprising ways to areas of your body, maybe even your mouth, that you've never, ever considered before? Perhaps it's time to think critically about your own health journey, to look beyond the obvious symptoms and maybe explore the broader implications of these hidden connections we talked about today.